As Labor Day weekend approaches, the NYC Health Department is advising New Yorkers to think about wearing masks, particularly in crowded indoor settings, due to mounting concerns about increasing COVID cases and the emergence of two new variants. According to a spokesperson for NYC's Health Department, it's being suggested that wearing masks in crowded indoor areas during this holiday weekend, when large gatherings are expected, might be a prudent measure. However, they emphasize that there have been no changes to the official guidance, and the city has no immediate plans to make masks mandatory. New York City has been experiencing a surge in COVID cases and hospital admissions linked to the virus. As of August 29th, the infection rate in the city stands at approximately 18 cases per 100,000 people, though this figure is likely an underestimate due to reduced testing. Hospitalizations have also increased, with 502 COVID patients admitted to city hospitals on August 31st. While this represents a 5% rise compared to the previous week, it is still considerably lower than the peak earlier this year when nearly 2,000 patients were hospitalized. The rise in cases has been attributed to a highly transmissible COVID variant known as EG.5 or Eris, as well as concerns about another variant called Pirola or BA.2.86, which was detected in the city's wastewater, indicating its potential spread. Global and U.S. health authorities have called for calm, stressing that the majority of people now possess immunity against the virus. Dr. Ashwin Vasan, Commissioner of NYC's Health Department, emphasized the importance of vaccinations, testing, and adherence to preventive measures like masking, especially for vulnerable individuals. While questioned about whether everyone should wear masks, a spokesperson suggested that it would be a prudent measure to do so. The BA.2.86 variant has raised particular concerns due to its earlier lineage, and it has been identified not only in New York but also in Michigan, Ohio, Texas, and Virginia. With over 30 mutations that may enhance its ability to evade immunity and vaccines, there is currently no evidence to suggest it causes more severe illness or death. Face mask mandates in crowded indoor spaces were previously eased late last year, with final restrictions, such as masks in hospitals, also relaxed this year. There is no indication that any U.S. cities are considering reinstating mask mandates at this time. While New York City grapples with rising cases, Los Angeles has also seen a surge in COVID cases, with a doubling of cases within a month. Officials in both cities are cautious about predicting the return of mask mandates, but acknowledge that circumstances can change, emphasizing individual assessments of risk. In response to the increasing COVID cases, some hospitals in New York State have reintroduced mask requirements for staff and patients. Additionally, colleges such as Rutgers University in New Jersey and a college in Georgia have reinstated mask mandates. Nationwide, surveillance data indicates a slight uptick in COVID cases and hospital admissions, but these figures remain significantly lower than the earlier peaks observed this year when few restrictions were in place. There has also been a slight increase in COVID-related fatalities, underscoring the importance of continued vigilance and adherence to public health guidelines.